Welcome to this virtual session. I am Professor Xichao Liu. In this exhibit, you'll be able to see how COVID viruses transmit inside a classroom. COVID is an infectious disease that is caused by a newly coronavirus, as you see in the left bottom image. The deadly virus is very transmissible and it can cause long complications such as pneumonia. The lung of patients of COVID has very dense scarring. In the scarred lungs on the right, there are much larger areas of darkness, representing parts of the lungs that are having difficulty transporting oxygen into the bloodstream. COVID can transmit in three ways. First, contaminated objects and surfaces transmit viruses from hands to your eyes, mouth, or nose. This is also called fomite spread that is more likely on hand, non-porous materials like metal and plastics. People can expel droplets and tiny aerosols while speaking, breathing, coughing, or sneezing. Droplets are moist and slightly large particles that are considered to be the primary vector of COVID infection. Virus-bearing droplets can spread coronavirus through your eyes, nose, or mouth. Typically, droplets do not remain airborne long because they can settle down and contaminate surfaces. By contrast, aerosols are tiny particles staying in the air for several hours and travel further than 6 feet. Both droplets and aerosols are very small. Droplets containing COVID viruses can be as small as 1 micrometer, that is 60 to 100 times smaller than the diameter of the human hair, where aerosols are even smaller. In this exhibit, we will visualize the airborne transmission of COVID inside a classroom and learn strategies to diminish the transmission and infection. We can start 3D printing seated students and their desks and locate them inside a skilled classroom. And the classroom can be made of plexiglass panels. We can also print ventilation air diffusers and connect them to a fresh air pump. The blue tubes you see are ventilation ducts connecting all the air diffusers. After all components were assembled, the whole model was brought to a studio lab for video recording. An approach to visualize the airborne transmission of COVID is apply smoke to simulate aerosols from a student's respiratory activity, such as talking or coughing. Before COVID, we typically sit each other near in the classroom. And of course, we did not need to wear a mask. We keep social distancing. So let's imagine how COVID would travel to you if a student just behind you get infected and exhale COVID towards your back. In this setup, the student sits in the middle, carries a small tube on the shoulder. We'll inject a stream of smoke through the tube. You can see from a video that the smoke can travel even beyond the desk, then reach the back of the students in front and likely get inhaled afterwards. A simple way to reduce infection risk is moving desks apart so the aerosols will not reach another student directly. This is called social distancing. When the students are seated far away from each other, the smoke partially settles down on the desk and the floor before reaching another student. In the classroom, keeping social distancing is quite effective in reducing transmission. You've been wearing a mask for a while, and you probably heard that such piece of cloth can prevent the transmission. But you'll see soon how a mask can block the forward-moving droplets powerfully. We can cut a tiny piece of regular paper mask and put it on the mouth of the infected student. In this video, you can see most of the smoke is blocked by the mask and only a small fraction comes out from the bottom of the mask. It turns out that wearing a mask in the classroom can protect you and others from the COVID transmission. The third method to reduce COVID transmission is ventilating the room. The role of ventilation is to introduce outdoor fresh air into the classroom and dilute COVID viruses. You can create ventilation simply by opening windows or doors if outdoor air is not polluted, such as by wildfires. Some classrooms have a dedicated mechanical ventilation systems that uses a fan to blow fresh air and delivers it into the room from either ceiling or floor level. In this exhibit, we'll focus on ventilation through the floor, also called underfloor air distribution system. In this video, ventilated airflow is visualized by smoke. This classroom has 8 ventilation diffusers on the floor. The outdoor fresh air will mix and dilute indoor COVID viruses and eventually move them out of the room. You can also imagine pouring clean water into a bucket with polluted water inside. We measured the aerosol level near the infectious student. The red dot in the photo was where aerosols were sampled. When the student had a cough without wearing a mask, aerosol level rises immediately and then started decaying gradually because of the viruses exit the room or get inhaled by others. When the classroom has ventilation, COVID level can drop much quicker than ventilation lacks. In this exhibit, ventilation can reduce indoor COVID to 10% within only 15 minutes. Your classroom might not have a ventilation system, or opening windows or doors is not a good option. But this does not mean that you can't control COVID to a lower level. An air purifier can remove the COVID from air in the classroom as well. But how powerful is an air purifier in the classroom? The top right photo is an air filtration unit that is commonly used in commercial air purifiers. The circular module contains folded papers that can trap COVID while letting air go through. You can imagine that there are dozens of high-quality masks packed inside a circular unit. You put this unit inside classroom. When it was turned on, COVID level reduced dramatically. Within only 5 minutes, the COVID level was decreased to 10% of the original level. I'd like to summarize some takeaways from this exhibit for you. First, COVID viruses can transmit via indoor air. Second, you have multiple strategies to protect yourselves. Keep social distancing, wear a mask, ventilate your room if you can, use an air purifier. And you can also use a combination of multiple strategies together. At the end, please allow me to introduce our team of this virtual exhibit. In addition to myself, Georgi Zhukov, Ali Zimmerman, and Chao Wang have made great contribution to this session. Thank you again for your watching.